Have you ever put your keys down and couldn't find them? Do you have trouble recalling people's names? If you've ever wondered if you or a loved one had dementia, then you aren't alone. When polled, dementia is one of the scariest things that people fear with aging. So what are the symptoms of dementia? Forgetfulness, getting confused, forgetting birthdays? Well, I'm Dr. Rick Kelly, a practicing physician with over 30 years of clinical experience in primary care, and I want to help you understand what are and what aren't the symptoms of dementia. According to Alzheimer's Disease International, in 2020, 50 million people worldwide are living with dementia, and the number of cases are expected to rise, even though dementia is significantly underdiagnosed. First, let's answer the question, what is dementia? Dementia is the umbrella term given for brain syndromes that affect memory, thinking, behavior, and emotion. These changes make it hard for a person to remember, learn, communicate, and interact with those around them. The end result is that it makes it harder and harder for a person to take care of themselves, and eventually they require help for all aspects of daily life. Initially, the cognitive changes may be mild annoyance, or the person may deny or even laugh off any problem. Later, personality changes, disruptive behavior, and memory disruption progress to a point where they can't be ignored. At times, though, a person who has dementia may not be aware of these problems. It's been reported that 20 to 50% of people with dementia have not been diagnosed or are undiagnosed. Let me pause a moment and say a few words on the cause of dementia. Many people use the term dementia interchangeably with Alzheimer's disease, although they aren't the same. Dementia, as I said, is the umbrella term we use when there's a loss of brain function. Of all the types of dementia, Alzheimer's disease is the largest group and makes up 60 to 70% of cases. And it's the sixth leading cause of death in the U.S., killing more than breast cancer and prostate cancer combined. The next is vascular dementia, which is caused by many tiny strokes, or what we call infarcts, which is where small arteries in the brain become blocked. It occurs in approximately 10 to 20% of the cases of dementia, and it's usually due to long-standing hypertension or cigarette smoking or other factors. Many of these strokes are basically asymptomatic, though they may cause symptoms, and they can be seen typically on MRI or CT scans of the brain. Next is frontotemporal dementia, and this, as the name suggests, is a type of dementia that affects the frontal and the temporal lobes of the brain. This type particularly leads to personality changes. Another is Lewy body dementia, which is around 5%. And it's similar to Alzheimer's with some Parkinson's symptoms mixed in. The person shuffles around and loses their balance and seems to be real slow. They may also have hallucinations. And there's a small percent of those with dementia due to neurodegenerative changes such as Parkinson's or multiple sclerosis. And then there's those that are due to toxins or drugs, alcohol abuse, or head trauma. Okay. What are the signs and symptoms of dementia? I'll go through a list of common ones, but remember that not everyone with dementia will have all of these, and some people that have these symptoms don't have dementia. Some may have just a few, and the symptoms may be mild and very subtle, or they may be glaringly obvious. Many of the problems with dementia result from a loss of memory, but others are due to a loss of what we call higher level functioning of the brain. A few examples of higher level functioning would be working puzzles or building models or following recipes, anything that you have to follow a series of instructions, or maybe calculating the amount of materials required for a project. As I said, some of the symptoms may be more pronounced than others, but one hallmark of dementia is that it's not reversible and tends to progress over time. Most types of dementia will show a consistent deterioration over time, though vascular and some of the rarer types may have more of a stair-step type change over time. So here we go, and these aren't in any specific order. Recent memory loss. All of us can forget things and then remember them later. If you're over 50, you've noticed that more and more. The difference is that people with dementia frequently forget things, but they don't remember them later. They may tell you a story and then repeat the same story a short time later. Or they may ask you a question about someone or something and then ask you that same question over and over and over, each time forgetting that you already answered that question. That's because they aren't making short-term memories. They may well remember what they did 60 years ago, but can't remember a conversation that you had just 30 minutes ago. I'd like to give you a little memory test. I'm going to say 5 words, and you can say them out loud if you wish. In a few minutes, I'll ask and see how many you can recall. Okay. Box, snake, tree, orange, jug. Got it? Next is difficulty performing familiar tasks. People with dementia might heat something up in the microwave and then forget that they put it there. Or they may cook a meal and forget to serve it, or they may even forget that they cooked it. It can be especially dangerous and frightening when they put something on the stove and then walk away and forget that the stove was turned on. Next is problem with words. People who have dementia may forget simple words or use the wrong words. This makes it hard to understand what they want. This is called word finding aphasia. They may say things like, you know, the thing you use to cut the cloth with, or the thing you dig in the ground, you know. Or they may use an incorrect word that starts with the same letters of the desired word, like floor instead of flower, or sack instead of sand. Next, confusion about people. People with dementia can forget that a deceased family member, like their spouse or their parent or a deceased child, are not alive. They may forget the names of their spouse or children or their caregiver, and they'll argue with them about it. It's particularly upsetting to everyone when the family member with dementia can't remember you or other family members. Confusion about time and place. People who have dementia may get lost on their own street. They may forget how they got to a certain place and how they get back home. This isn't a place where they've been only once. It's a place they've been driving back and forth to for years, and it's very scary for them. Okay, now try and recall the 5 words that I gave you before. I'll give you 10 seconds. Okay, the words were box, snake, tree, orange, jug. How'd you do? Leave a comment below and tell me how many of the 5 you were able to recall. But let me say, whether you got all 5 or you missed some of them, that does not mean that you have dementia. Next symptom or sign that we see in dementia patients is poor judgment. Even a person who doesn't have dementia might get distracted or forget to watch a child closely for a few minutes. But people with dementia may forget all about the child they're babysitting and just leave the house and be gone for the day. They may not understand that they're being scammed when someone calls and tell them that they have to hand over their credit card number or purchase a gift card to pay back taxes and transfer thousands of dollars to a person they don't even know over the phone. Problems with abstract thinking. Anybody might have trouble balancing a checkbook or keeping a ledger, but people with dementia may forget what the numbers are and what has to be done with them. Misplacing things. People who have dementia may put something in the wrong places. They may put their keys or phone in the freezer or their wristwatch in the laundry basket. Of course, they can't find them when they need them. Or they may put the milk in the cabinet instead of the refrigerator and it spoils. Changes in mood. Everyone's moody at times, but people with dementia may have fast mood swings, going from calm to tears or anger in a few minutes, or maybe laughter, and often they're inappropriate to the situation. The symptoms can worsen as dementia patients lose the ability to understand or process the information that's around them. This loss of cognitive function produces a range of emotions, including anxiety, frustration, and anger. And dementia lowers a person's inhibitions in expressing feelings, resulting in outbursts or even spells of extreme laughter. Personality changes. People who have dementia may have drastic personality changes. They may become irritable, suspicious, fearful, "Get off my lawn!" Or, for example, a gentleman that's always been a faithful husband may make sexual advances to the nurse aides who are taking care of him. Or someone that always wants to know how others are doing and how she can help. As dementia progresses, she doesn't even ask people how they're doing or seems to just ignore them altogether. Instead, if anyone asks how she's doing, she may start crying or constantly complain. Or maybe a lady that's always been a deeply religious woman and very careful with her words, now she's cussing up a blue streak. Then there's a loss of initiative. People who have dementia may become passive. They may not want to go places or see other people. They may prefer just to sit at home and stare, not doing anything productive when they used to be very active and were always doing something. Changes in sleep. Changes in sleep patterns are often something that comes with age. However, sleeping more than 9 hours per day is associated with an increased risk of dementia. But what is not dementia? Everyone wants to know that. They misplace their keys or phone and it takes them a moment to remember something, but they get there. That is not dementia. Also, delirium is not dementia. Delirium is a temporary loss of mental function which comes on suddenly. It could be due to a medication side effect or a bad infection like pneumonia or a UTI. Delirium sometimes occurs when elderly are hospitalized and they get disoriented or out of their head. Also in the elderly, sometimes depression can mimic dementia with some of the same symptoms. So that's something that their doctor should consider. So if your family member or loved ones have one or more of the signs or symptoms of dementia, get them in to see their primary care doctor and have dementia screening done and a complete evaluation. It may be that if you don't initiate the encounter, their dementia may not be recognized for years, and then medications are not useful. In the upcoming days, I'll be releasing additional videos, some on dementia. If this video has been helpful to you,